Symptoms: Addison's disease symptoms usually develop slowly, often over several months, and may include extreme fatigue, weight loss and decreased appetite, darkening of your skin, low blood pressure, even fainting, salt craving, low blood sugar, nausea, diarrhea or vomiting, abdominal pain, muscle or joint pains, irritability, depression, body hair loss or sexual dysfunction in women.
FlashMed. What are the physical exam differences between primary adrenal insufficiency, Addison's, and secondary adrenal insufficiency? In primary insufficiency, there is hyperpigmentation due to increased ACTH. In secondary adrenal insufficiency, there is no hyperpigmentation because ACTH is decreased. The signs and symptoms due to mineralocorticoid deficiency are not seen. FlashMed, video flashcards.
The two glands situated on top of each kidneys, adrenal glands. Normal cortisol levels are essential for life, and they are essential since early life. They have a very significant role in growth and sexual development. They maintain normal blood pressure, blood glucose, body temperature. They help us having a good immune response and response to acute illness and stress. And, you know, we could talk for an hour just about this. So,
some of the symptoms that you might experience is that you'll have increased tiredness. You'll have pale and dry skin. Your face will be puffy. Your voice may be hoarse. You may have an increase in cholesterol. You'll have a weight gain perhaps, pain and swelling in the joints, muscle weakness, depression. For women, menstrual flow may be increased. There might be constipation and sensitivity to cold. With this, you will see that there'll be a sluggish feeling also, that the person feels like they're just dragging their.
But the problem is not everybody has elevated TSH. There's a lot of patients that I've seen over the last 18 years where they come to me with these full-blown thyroid symptoms, but their TSH is within the quote-unquote normal range. Well, what I found over the last 18 years in practice is the normal range is not actually the normal range.
Symptoms. People with small prolactinomas or microprolactinomas often have no symptoms at all, whereas those with large prolactinomas, macroprolactinomas, might have vision problems like bitemporal hemianopia or headaches where the meninges is stretched. In women, excess prolactin causes galactorrhea, which is milky nipple discharge, amenorrhea, which is missed menses, and vaginal dryness and brittle bones in old age. In men, excess prolactin causes gynecomastia or breast enlargement and erectile dysfunction. And both sexes can experience decreased libido and infertility.
Pituitary hormones, what's the big deal? Pituitary disorders are common, but experts in treating them are not. Small changes in replacement may make a big improvement in symptoms. Many endocrinologists do not understand how to properly replace patients with hypopituitarism and do not understand or don't believe in monitoring hormone levels. We simply see the need to do more. We'll start talking about growth hormone deficiency. Patients with hypopituitarism have increased mortality that's suggested but not proven to be due to growth hormone deficiency. Growth hormone deficiency in adults results in decreased bone formation, increased fat mass, specifically central obesity, decreased muscle mass, lipid abnormalities, increased thickness of blood vessels, increased inflammatory markers, impaired quality of life, increased number of sick days, and impaired exercise tolerance. Most importantly, most of these symptoms are corrected by treatment. Do patients with Cushing syndrome need to have all the signs and symptoms listed in the textbook? No? Okay. No. So the textbooks show the most severe cases. Most patients have some but not all signs and symptoms of Cushing. Patients are being diagnosed earlier and patients with mild symptoms. They only have some of the signs and symptoms of Cushing. The common symptoms of Cushing's IC Most common that I don't think is appreciated in some of the textbooks, including, except for mine, wired at night, trouble sleeping, trouble falling asleep or staying awake, frequent awakenings, severe onset, usually of new onset. People say that the fatigue of Cushing's is worse than any other type of fatigue. Abrupt weight gain without any other causes, such as decreased activity or depression, decreased ability to exercise, menstrual irregularities, cognitive changes, the famous brain fog, decreased libido, symptoms of adrenal insufficiency, such as joint pain, can't get out of bed, nauseousness and vomiting, and depression, anxiety, and mood swings. Are all patients with Cushing's obese? No. Nope. Patients who really watch caloric intake and exercise, which is often hard because you get tired with Cushing's, probably do not gain much weight. If you start thin, you probably won't become obese also.
Your doctor may say you have what's called metabolic syndrome. Here are the risk factors: a large waistline, high triglycerides, unhealthy cholesterol levels, high blood pressure, and of course, high blood sugar.
Next is high blood pressure, high cholesterol, high blood sugar, which can also lead to or stem from a glucose intolerance and insulin resistance, which can lead to diabetes. Next is truncal obesity, which is an accumulation of fat around your face, your neck, your abdomen, collarbone, back, all that. So
PCOS can disrupt the menstrual cycle, leading to fewer periods. Acne, hair growth, weight gain, and dark skin patches are other symptoms of the condition. Does PCOS put me at risk for other conditions? If you have PCOS, you may be at higher risk of other health problems. These include diabetes, high cholesterol, high blood pressure, heart disease.
So a couple months ago, this will be like the shorter version of it. A couple months ago, I told you guys that I had PCOS, and in fact, come to find out, that is actually not what I have. I got misdiagnosed. I went to my my doctor here in Northern California. I demanded that I go see, or I told her that I wanted to go see an endocrinologist because I felt like that was her specialty. So I'd rather go see someone who specializes in, you know, something rather than just being a general doctor. Especially since I know that my hormones are all out of whack and I'm completely just not normal right now as far as like my hormones. So I went to an endocrinologist. From there, I got 2 blood tests done because the first one came back that I had a high level of prolactinoma in my system, and she was like, okay, well so that's kind of weird. So let's have you do another test, except I want you to, do like the blood, or do the fasting before you do the blood test. Did that, came back exactly the same. Actually, it came back higher. The prolactin in my system came back higher the second time. So she told me that with that, usually she would schedule an MRI because usually with a high level of prolactin in the body, there's usually a brain tumor of some sort in the pituitary gland. So got my MRI done. The results came back that I indeed actually did have a brain tumor, and it's not cancerous. It's very small in my pituitary gland. That doesn't take away the fact that, like, this whole time I thought I had PCOS, And it doesn't take away the fact that, although, yes, I finally am so relieved to figure out what I have, and this has been my answer the whole time.
Hey guys, it's Vanessa. Welcome back to my channel. Today I wanted to make a quick video on how I got diagnosed with Cushing Syndrome. It took me a few years to go get diagnosed, and during those times I saw a lot of doctors who kind of brushed me off and told me, oh, you know, you just have PCOS, you're just depressed, get on antidepressants, you need to go on a diet and lose some weight, and you know, they would just always like try to prescribe me birth control pills as a solution, and I did take it.
So if a woman is having menstrual problems, that can often be a clue that she's having a hormonal problem. She could be having a pituitary problem where her pituitary is not functioning properly, and therefore she's not making the hormones that stimulate the ovaries to make estradiol. She could have a condition called polycystic ovarian syndrome, where she's making too much testosterone, or her ovaries are maybe overactive, and that's causing her not to have a period. She could be having a pituitary problem. She could be having a pituitary problem. She could be having a pituitary problem.